Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account, you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications which are sometimes overlooked. So overall, we hope that by watching the video diary program, you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
My name is Mari Breed and I live in Thorpe Astley. I'm a 57-year-old South African English woman, by career a professional nurse. I came to England the end of 2000 to come and explore what private nursing is all about in England. And in March 2010 I was diagnosed with hormone positive breast cancer.
Mari Breed has come in today, and thanks for coming to join us on this video program that we call Cancer Stories. I don't know much about your account because you've been seen by a colleague of mine, and this is the first time we've met today, isn't it?
That's right.
But I know viewers will be interested to hear about how the diagnosis came about and what happened after the diagnosis. Shall we start with the diagnosis itself?
I had a mammogram in February and I was recalled back to Glenfield Hospital, and they did the mammogram and looked at the previous mammogram and found there's something wrong. They immediately did a biopsy, and I was recalled back a week after, where I had the final diagnosis of breast cancer.
What was your overall feeling about how the process had been handled by the medical staff?
I think very, very good. I was very pleased with the way that they treated me as a patient.
Because I can perhaps say now that you have medical and nursing experience, because you're a qualified nurse, aren't you?
Yes, I am, but it's difficult. You know, if you are a nurse, you know what to do, and suddenly you are a patient and you don't know what to do.
Do you think it alters your view if you have some medical knowledge when you come to the point of receiving treatment? Does it alter how well you can handle things, or?
I think like I said, if you are a nurse, you know what to do, you know how to support somebody else that's in a situation. But I think when I'm in that situation, I know what to do, but I didn't know would it be the best for me.
Okay. And so let's go on with what happened to you. What was the next step after you received the diagnosis?
The next step, they immediately arranged for surgery, breast surgery, and so I went into hospital the end of March 2010, and although I wanted a mastectomy, they recommended a lumpectomy. It wasn't necessary for that major procedure, and I was quite okay with that.
It's not always easy to know how to interpret that, is it? If they say you need a lumpectomy, some people feel that from the start they would prefer to have very definitive surgery. But other people feel, well, that's good news because it means only a localized area is involved.
That's right. And I found the whole surgery experience went so well. Although they wanted to do sentinel biopsy, and that didn't work out with what they did before the real surgery when I went to the theatre. But anyway, everything went well with the surgery.
How long did it take you after the surgery was completed to start to feel back to your normal self?
To be honest with you, now after 2.5 years, nearly 3 years after my diagnosis.
It's taken a long time.
It really took a long time because at the time, just 2 months before my breast cancer diagnosis, I had a work injury and I had to go for a total knee replacement, and that surgery, major surgery, I had in January 2010, and then I just had to cope with the fact that, okay, now I have breast cancer as well. And that came actually difficult, or not difficult to cope with, but together with other major surgery that I already had, I think it had the impact 2 years after both of the two operations.
So you really had two major things to cope with around the same time?
I did, yes. And because I'm a nurse, I also think that I have 2 knees, and both of those knees I need to do my job as a nurse. So the breast cancer was at that stage just a side diagnosis for me instead of a major diagnosis. So I just focused at that time on my knee and my knee surgery that I have to, that I had.
Now, what was your view from that early stage, recovering from surgery, about going back to work? Because that's an issue for a lot of people.
I had always this issue that I want to go back. I need to go back because once a nurse, always a nurse. But I definitely, at the beginning, I wanted to go back to work, come what may.
And how were you able to do that? Did you find that the workplace made that any easier by talking to you about the situation?
I think the negative thing about me is working for nursing agencies most of the time, that I didn't have support of an employer at all. So if I, had that at the time, maybe I would cope better with the diagnosis of breast cancer.
And what actually happened regarding return to work for you?
I couldn't return back to work because the company that I worked at that stage went into financial problems. So I actually also lost my job.
So you've been coping with another facet here, which is not working when you would have otherwise carried on. You've been very pleased to carry on.
That's right. And unfortunately, I had employment tribunal that I also had to cope together with everything, and I knew that I couldn't go back to my main employer.
Now, I'm sure, having just briefly spoken to you before, that would have impacted upon you financially as well. And I know
Financially, I can tell, to be honest, it's not very easy to talk about that, but together with my work injury that led to a revision of my total knee replacement, the diagnosis of breast cancer had a very, very big impact on my financial situation. I was in the beginning kind of a risky person with finances. I coped well doing my own budget, etc. But this put me in a very, very bad financial situation.
It's a difficult area to go into, I know, but I also know a lot of people are similarly affected by that. And there is an issue about how much help is around for financial concerns after a diagnosis of cancer. What was your impression of what help was available? I
didn't know how the benefit situation would be, but I got advice from the Citizens Advice Bureau to go to Department of Work and Pensions, and I was able to get employment and support allowance due to my income that I had before the diagnosis of my breast cancer. So that's not a big amount. It's under £400 to be straightforward about the finances, but to cope with a mortgage, to cope with car that you need for work, with all your other outgoings, it was a difficult situation as well to cope and to have just that small amount of money to live on. Is there anything you'd recommend for people who have a recent diagnosis but are worried about going back to work? You know, they may not be returning to work and financial problems are beginning to surface. Is there anything you'd say to those patients? I think there's a lot of people that can help you and advise you on that. But because I didn't have an employer that support me on that issue, I had to go by myself. Macmillan nurses, I know that they was involved and could help you, so I was in contact with them. They helped me to get the right kind of allowance that I can get. And then the Citizens Advice Bureau as well. But from the straight beginning that I gathered all the information, I did my application, and there was just not one day that there was a problem with any kind. I'm a very, very honest kind of person, and sometimes I tell more information that's needed, but I just think that I just want people to know that I'm honest with everything. Well, I definitely respect that. Now, do you think if you'd been unwell back home in South Africa, would the situation have been any different? Can you compare the health services? I think the health services in South Africa are more like the American side, how they deal with medical help and medical support. In South Africa, we have medical insurance that help you with your financial issue with regarding medical, surgical, and all the treatment. Here I found it very, very easier, much more easier to deal with. You know, I went to my the breast clinic, I had the mammogram, I was recalled back. It just followed step by step until everything was sorted. Let's return to the journey that you had through the cancer process and the treatment. You mentioned now about the surgery. What other treatments followed the surgery for you? Luckily, I didn't need any chemotherapy, and I was quite frightened about that. I was also frightened about the radiotherapy. I was really, really frightened. Although I supported a lot of people that went themselves through radiotherapy, surgery, etc., chemotherapy, but I can remember my first day when I went for my first treatment. I was so anxious and I was so scared. I was scared to death. But the people at the department helped me to cope with that. And after the first treatment, I just feel, oh, it wouldn't be easier than that with all their support and their soft words.
You found that it was manageable in the end?
It was manageable at the end, yes.
Yeah.
And yes, I flew actually through my radiotherapy. And then I had to start on anti-cancer drug therapy. I started, but had quite a frightened experience that I got an allergic reaction with the Tamoxifen that they put me on. I had to rush to hospital and then back, but the oncologist supported me through that. I stopped taking that for a week or two and was restarted with the therapy until about 3 months ago, where I got very, very side effects that was my quality of life definitely decreased with that, and the oncologist decided to stop the treatment for a couple of months.
Do you want to mention those side effects, because they're potentially ones other people might be familiar with?
The side effects was, the flushes and the hot turns.
Yes.
That's definitely not a nice experience. But not just that, every week or so I had vaginal reactions due to that, bleeding, thrush-like symptoms. That was not very nice, and until at the point that I just said to myself, no, I can't cope with that anymore. The hot flushes I could cope with, the warm feeling I can cope with that, but every week with this kind of symptoms I was not very happy. So the oncologist decided with that we can stop with the treatment.
Yeah, I mean, sometimes if you're able to discuss these side effects, even if they are potentially difficult to mention in the appointment, often a alternative treatment can be found, or some modification to the regime given to make things easier. In your case, I think the medication was swapped. Is that
yes, the oncologist put me on another treatment, Remedix.
Yes.
And I don't think it's because I'm a nurse, but I got that side effects as well.
Okay.
And I didn't know I have so many joints in my body. As a nurse, I should know, but as a patient, I didn't know. The pain that I experience now, I cope with that. But it's still, I have to take pain medication for that. Otherwise, I wouldn't cope.
So one thing that viewers always want to know is what resources are out there, or how people coped with a difficult situation. I know you had a lot on, not just the cancer diagnosis, but what did you find helped?
The way that I coped with my diagnosis of cancer, breast cancer, was I tried to get all the information, leaflets, booklets, everything that you can think about, and I put it all in a folder to say to myself, I will read it someday. But through the time, I collected everything and I read through that. That helped me to cope with everything quite well. But I also could remember that my second night after my breast surgery, I was very, very emotional. And there was a nurse in the ward that came to talk to me, and I just said to her, listen, it's the first time that I'm emotional about my breast cancer. When I was diagnosed at the clinic, my friend was with me and she cried, and I had to cope with her crying instead of me crying. And the nurse in me came out but the patient in me came out that second night after my breast surgery. Now, through the time because of all the issues of my knees and my problems that I had with my knees, I didn't actually make time for myself to cope with breast cancer. I said to myself, sometime or someday I will cope. And I actually break down when I had all the side effects of the Tamoxifen and all the side effects that I felt that let my quality of life down. I end up talking to the oncologist and I said to her, I think, and that was 3 months ago, 4 months ago, I said to her, I can't cope anymore. I need to talk to somebody. And she referred me to the services, the
psycho-oncology team.
That's right, to this team. I met with Sue Todd, and from the first time that I was there, I couldn't talk enough. I wanted to talk about everything, and she just let me go on, and I just talked, and I was so pleased to have somebody like her to talk to, that actually in 3 sessions I worked through a booklet that she gave me without reading through it, and I coped with it just through talking.
You did the principles that are in the PACT booklet.
That's right, with her asking questions and me answering it. It helped me a lot.
Well, that's really good to hear that you did get help through that source. Let's just imagine for a second that wasn't available. I know things would have been more difficult, but were there other sources of help around that you could have accessed?
I think at that stage, I thought, just give me one person to talk to. I don't want many people involved in my psycho problems at this stage. I just want one person that can listen to me, because I didn't talk to anybody about what's really going on in my mind and in my heart about the diagnosis. All I know, I need someone.
Do you think that talking therapy, that one-to-one person, should be available for everyone who's had a cancer diagnosis?
I think if I could have this service straight at the beginning, I think that I wouldn't have the issue of the emotions in me, and what I feel in me wasn't as severe now. So I think it would be a best thing, a good thing, of having this kind of service straight in the beginning. Every patient, not just the patient that can't go, but every patient.
One innovation that's coming along is to have more peer support, that support from other patients who've been through a similar situation. And that could be in a group format or even one-to-one as well.
I registered with Breast Cancer Care in the UK, and through that website, I got in contact with a person that I could talk to. And actually, I remember that now. That helped me a lot, because I just wanted to know about the side effects, because I think in my mind, I just thought, oh, I'm a nurse and I'm sure every side effect will come to me. That is just one of those things. And I had the support of that website and a person that called me, and I had several kind of discussions with her.
Is that time limited, or does it go on as long as you need it?
I think, I actually can't remember. I just think that after 2 or 3 telephone sessions with her helped me to cope with that.
And what do you think overall about the power of meeting other patients and hearing their accounts?
I think if I could meet maybe peer people that went through the same thing, maybe that would help me to cope better. But I think I know myself, and I didn't want to get involved in so many people know what I am going through. So this service for me that I got from Sue Todd was enough for me.
Thinking about the emotional side, and in particular the recovery from those difficult times, how much back to your normal self do you think you've been feeling of late?
I think emotional, I'm back to normal by myself. I don't think that will be the end. I'm always worrying about when are they going to tell me I have secondary breast cancer. And that is a other issue. But yes, I think if I can think in the beginning, when I was diagnosed, I didn't want to go out all the time, and that I'm talking about the past 2 years until the time that I was in contact with the services that I got from you. I didn't want to go out. I stopped buying things for myself. I didn't want to do anything because I'm going to die. And that was ongoing, and that broke me. It broke me. Emotionally, it broke me. And at the end, I could talk about that. And now I'm back to normal. I want to buy more than what I needed now. But yes, I think emotionally, I'm back to normal again.
Now you're raising a very important issue there, which is to what extent do people feel able to push themselves in going out and doing more when they don't necessarily feel like their normal selves. They feel like things have been taken away from them. But it is important to try to do normal things as much as possible, I think.
You know, if I could remember that in the beginning, I wanted a mastectomy. Emotionally, I think I would cope at that stage because I have my knees going on to cope with. I coped with that, and as I said, that the breast cancer was a side diagnosis. So I think if I had a mastectomy at that stage, emotionally I would cope because I coped with the other problems. But if I think now, I wanted to go back for a mastectomy, but I know myself in the past 2 years, I wasn't ready for such a big major surgery again. But I wanted it, and I talked to it with Sue, and she also said to me, "You're not emotional right for that operation," and I had to agree with her. And now that I feel that I'm back to normal, I don't think that if I go for something like that now, I would be emotionally better to cope with it as maybe in the beginning.
And you mentioned again about your knees, and I just want to make sure I understand, because the knee problem sounds really very serious for you.
It was because, you know, like I said, I do need 2 knees for work, and I want to go back to work now, and actually going back to work maybe in January, and yes, that was a very, very big issue. But if I can say to you now that breast cancer is also a very big issue, and I wish if I had that kind of service to talk me through, emotionally talk me through the whole diagnosis of breast cancer, I think I wouldn't be in such a mess 2.5 years after my initial diagnosis.
there's perhaps another angle as well that I heard you mention before, but I want to pick up on, and that's about reconstruction. So I think you were discussing reconstruction with the team at one stage. What was the outcome of that?
I discussed that with the plastic surgeon, and actually I'm still awaiting to have a meeting with the breast surgeon as well as the plastic surgeon regards a mastectomy. I will go for that meeting. Maybe because I'm emotionally right again, positive again, maybe I could speak to them in a mature way that I maybe didn't do at the beginning. So yes, I'm really emotionally better off now after I spoke to somebody as well that could help me through the emotions and the feelings of breast cancer. I'm now emotionally more myself again.
That's really good to
and
hear.
I would cope. I think I would cope with that operation when I have the meeting with the surgeons.
Yes. So imagine a new patient watching this account for the first time. Is there anything that you'd like to say to them as kind of a benefit from your experience, everything that you've been through to date?
I would really think that this kind of service is not needed, is a necessity for every woman that's going through breast cancer. It doesn't matter who you are. If you're president of that union or a nurse or a normal person like me or a doctor, I think the fact that there's somebody else involved in that process of you going through emotions and feelings, yes, it's not a needed service, it's a necessity.
And when do you think people should actually ask for help? At what stage?
I would say immediately after your breast cancer diagnosis, as early as possible, maybe before your breast surgery, because if you have this kind of service before breast surgery, I know there's not a lot of time, it's about 2 weeks, a week or 2 weeks, but just your first initial appointment with somebody that can help you just to cope with the first feelings and emotions of the diagnosis as well as the coming breast surgery.
Let me ask you what family support you have around that's available to you right now.
Because I am a South African English breast cancer person, yes, I think the family support is very, very needed. I have 4 sons. One of my sons are actually in England, and I could remember the first day he took me to the clinic where I got my breast cancer diagnosis. When I came out, I said to him, "There's something I want to tell you." And he said to me, he asked me, "What is that?" And I said to him, "I have breast cancer." And he actually must supported me, and he didn't want to talk to me about breast cancer at all. And he didn't up till now, today, he didn't speak to me about breast cancer. My other 3 children was very supportive. From the eldest through to my mother, I couldn't tell my mother directly. It was very, very difficult for me to tell my mother. So I told my eldest son, and he actually went to my mother to tell her about it, because actually you thought maybe it must be the other way around. My mother must come to me and tell me, "My child, I have breast cancer." But it was a changing situation, and my eldest son helped me a lot, and actually all the other three helped me a lot, as well as my other family helped me a lot to cope with that, with the diagnosis. Thanks to Skype, I could speak to a lot of people in South Africa, and I have good support.
Oh, that's good to hear. Let me ask you about another stress that I know is around for you. You may have just briefly touched on it earlier, but I want to pick up on it, which is the financial worries. I know a lot of people have financial worries, but it seems to have come to a head for you right now.
Yes, and actually just yesterday I received a letter from my good bank. They want to repossess my house.
Oh, no.
I think if I didn't have the psycho-oncology service, I wouldn't be able to cope with it yesterday. Luckily I spoke with Sue about this issue, and so emotionally I could cope with it yesterday, and I knew immediately yesterday what I should do, and I immediately contacted the Citizens Advice Bureau, and immediately she was there and she said to me, okay, we're going to address this, but don't worry. And I could say just thank you again. Yesterday I felt, yes, I could cope with a letter like that as well as with breast cancer, as well as financial situation.
Yeah, I mean, nobody would wish that situation on anyone, but just hearing how to deal with it and what practical steps to take is useful for anyone. So using the Citizens Advice Bureau, that's definitely a good tip. Any other source of financial help that are out there that you've come across?
I think the Department of Work and Pensions helped me a lot. It was not very easy as a professional nurse, earn quite good income to be in a situation like me, that I have to go and ask somebody for money to live on. That's not very easy. I never ever in my life asked even my parents for 1 penny or £1, and now with the diagnosis of breast cancer, with other medical issues that I suffer at present, it was very nice to have Department of Work and Pensions and the local Job Centre Plus. They was absolutely wonderful, helping me in everything. And the advice that I can give, contact them in the first place will be very, very good if you can do that, to get the information. Especially the financial situation. It's not very easy, it's not a nice feeling. You are embarrassed about this. I was always embarrassed about the financial issue from breast cancer diagnosis, but they helped me. They didn't let me down.
Thanks for addressing that on the video, because I know it's not an easy area to talk about, but I also know a lot of people are affected around this diagnosis with financial concerns. So it helps to have that out in the open to some extent. So a lot has happened to you, and there have been a lot of negatives in a way that you definitely trying to cope with and doing a great job there, but the viewer will think, well, is it all about adversity right now? But I hear something positive has come along of late.
Yes, I didn't mention that, but I want to mention that I am a Christian and I believe in miracles, and to mention 3 days before my radiotherapy started, I met Dave. Now, Dave is a funny story that happened to me, and I think if I wasn't diagnosed with breast cancer, Dave would be still around in Leicestershire and not meeting a person with breast cancer. About in April 2010, I think that was the time between or just after 2 major surgeries. I was really very low. I felt depressed. I felt very low. Emotionally, I felt I'm breaking down. And a friend of Dave decided it was time for him to meet somebody. So she went and she wrote a little advert for the local Leicester Mercury, for an advert to meet somebody with qualities that he wanted. But it was a very funny advert because she's a very funny friend as well. So she put the advert in the Leicester Mercury, and luckily on a Tuesday I bought the Leicester Mercury, and I went through it, and I came along with the relations advert or meeting advert, and I read this Dave wants somebody to meet. And the Sunday after I bought the Mercury, I felt very low, and I could remember I was sitting with my Bible and with the Leicester Mercury still lying next to me, and I decided maybe I must write a little note. Now, I'm a calligrapher and I like calligraphy, and I wrote a little note in calligraphy for Dave. But I didn't send it off because I didn't think, I'm not the kind of person that would do something like that. I was not, my parents didn't raise me to do something like that. Normally you meet people around, and now me, Mari, went to an advert from a paper to meet somebody. Why? At that stage, because I felt low and I didn't have a special person in my life. Okay, all the people, my family are special, but not that special. I posted it with my telephone number, and the next day I received a call from Dave, and he wanted to meet. So we met in Foss Park at a restaurant, and we had coffee from 2 o'clock till 6 o'clock. And at the straight beginning, when I sat down, I said to him, I wonder if it's the right time for you to meet me. And he asked me why. And I said to him, I was just diagnosed with breast cancer, and I went through breast surgery. You don't want to meet somebody with all these issues. And he said, no, it's just funny that I'm not. He said to me that he's not used to a person so outspoken to say to somebody else, I've been diagnosed with breast cancer and you did it. So I said to him, yes, I'm feeling very low, but now after all that time, something happens to me. I met something special after diagnosed with breast cancer. And I think if I didn't have breast cancer, I didn't meet Dave. And all I want to say with this issue, thanks for having breast cancer. With your service to talk about feelings, issues, emotions, everything I came out positive with Dave, and our relationship is very good, and we hope to hopefully we can getting married. As a Christian, I want to have a marriage, not just living together, and that all came out of breast cancer.
In general terms, what does the future hold for you?
Because I'm not a person that see my breasts as something that I'm going to lose. Yes, maybe I would lose a breast, but I actually thought about a bilateral mastectomy, and with a reconstruction. Maybe, if I think about that, maybe I could look better than now, that just after the plain, or the lumpectomy that I had. I don't know. Maybe I will decide, yes, I'm emotionally ready for an operation like that. Maybe because at the beginning, I wanted a mastectomy. Maybe after 2.5 years, I think, yes, I can do with that, with a reconstruction. But I think when I come at that stage, I will have a very, very good talk with Sue Todd again before I will go straight for that operation.
The bilateral mastectomy is a very big decision, not one that anyone should rush into, of course, but I just wonder if you've had the chance to talk to the oncologist about the effect of that operation on the future risk of a cancer returning.
At present, due to the side effects of the Tamoxifen and the side effects of the Arimidex now that I'm feeling, the pain that I experience every day, and that is really not nice to have. I really struggle in the morning to get out of bed because of my history of knee operations, osteoarthritis. But maybe if I can jump that side effects, the question that I ask myself, will I be ready for something as big as a bilateral mastectomy? Maybe after a very, very good talk, maybe I can make a decision to do that. Otherwise, I will just go on as Mari. I had breast cancer. I'm a South African English woman. I coped with it. Although it's after 2.5 years, I coped with it. I'm back to normal again.
And that's a really fantastic note to end on, I think, because you've been through not just the breast cancer, but the knee problems as well, and you have coped with it. And although you've had difficult times, seeing you now, I wouldn't really guess you'd been unwell. I mean, that's a very positive perspective right there.
Thank you. I'm glad I'm not limping anymore. I had to use crutches. I think my right hand crutch supported my lumpectomy on my on my right side. But yes, it's very nice to walk normal and to feel normal about my breast cancer as well.
So I want to wish you all the best for the future, and I hope things go well, particularly regarding planning for any future treatments.
Thank you very much. I appreciate this. And what I also, from my side, the services that you gave me, I really like to talk to other people, and anybody is welcome to contact me anytime, any day, and that will be my part of giving back about everything that was given to me. Although it was very difficult, it wasn't easy. After 2.5 years, it wasn't an easy journey, but I end up myself. I end up Mari Breed again. I end up Nurse Mari again, and I will end up someone that needs some support and information. Please contact me.
That's very kind. Thanks very much.